Building a business may feel like a big jump, but OnDeck Small Business Loans can help keep you afloat. With lines of credit up to $100,000 and term loans up to $250,000, OnDeck lets you choose the loan that's right for your business. As a top-rated online small business lender, OnDeck's team of loan advisors can help you find the right business loan to fit your needs. Visit OnDeck.com for more information. Depending on certain loan attributes, your business loan may be issued by OnDeck or Celtic Bank. OnDeck does not lend in North Dakota. All loans and amounts subject to lender approval.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Radio with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. And now, here is Jonathan Marks.
Hello, everybody. Hope you're having a good day. And before we start, I want to give you listeners a shout out. I'm following our numbers and I'm seeing our numbers go up every show, more people listening, more people downloading. And I want to give a big shout out and thank you to you. I encourage you, if you're interested, you can go to gotohealthmedia.com/get updates. And you can opt into our email list and also tell me the kinds of programming you'd like to see or hear, and we'll be happy to do that for you. So today we have with us Trina Wiggins, MD. Now, May is Arthritis Awareness Month, so we are keeping you aware with this show. Does arthritis have you limited in your mobility or movement, or do you suffer from arthritic pain that keeps you motionless or worse, totally out of shape? Dr. Trina Wiggins is going to help us today. She's a board-certified pediatrician who resides in Las Vegas. In addition to being a pediatrician, this is wonderful, she competes in fitness and dance competitions. She has competed in over 50 shows over the past 18 years with many top place finishes. In 2018, she competed in the Nevada State Senior Olympics and received a gold medal, not silver or bronze, but gold. She was named the AAU North American Bodybuilding and Fitness Champ for 2019, Athlete of the Year. And this year, she published her first book entitled KISS, Keep It Short and Simple for a Healthy, Sustainable Lifestyle. Trina herself has arthritis, and she's a physician, so she knows how to deal with this. So Trina, welcome to the show. How are you today?
Oh, I'm doing fabulous. Thank you for having me.
Good. So let's start off real simple. I
Sure.
got three questions for you. First, what is arthritis? And that's number one. We'll get to that in a sec. Your way of dealing with it and getting around it. And then any other diet or supplements or other recommendations you have for dealing with this. So that's what we'll cover. So let's start simply, Trina. What is arthritis? How do people get it?
Yeah, so osteoarthritis is the most common type of arthritis. There's many types. You have rheumatoid, but today I'm going to focus on osteoarthritis. It's a degenerative disease that damages the cartilage between the joints. And, cartilage is that rubbery material that covers the end of bones and provides us with a cushion between them. It is a result of wear and tear over the years, and the primary joints impacted are the hands, the hips, and the knees. And the typical presentation is asymmetrical, which means it affects one or more joints on one side of the body, as opposed to, say, rheumatoid, which is, symmetrical with both sides.
Ah, I didn't know that. Okay. And do we just kind of get it? Is there something we can do to prevent it? Or is this really just kind of a function of age?
Well, there are risk factors. Age is definitely one of them. One's weight plays a role. The more weight that you carry, it impacts your weight-bearing joints. For example, for every 1 pound of weight, it's equivalent to about, if you lose 1 pound, that's equivalent to losing 4 pounds of pressure off your knees and 6 pounds off your hips. So weight is an issue. Like I said, age is an issue, and any pre-existing injury. And for me, that's where this really all started, because I was a gymnast back in the late 70s and 80s. And back in 80, I sustained a career-ending knee injury to my right knee. 15 years later, I re-injured the same knee. And both of those injuries were basically a setup for my current knee osteoarthritis.
Got it. So how do you deal with arthritic pain? What do you do?
So it's a combination of things. As we know, there's really no cure per se. So my goal is to manage and minimize the symptoms with various therapies. First of all, I want to make sure that I'm engaged in physical activity, stretching, and strengthening exercises most days of the week. And I always want to start with the least invasive method to deal with the pain and stiffness. Now, for example, for the pain, I start with ice to my knees 2 to 3 times a day for about 10 to 15 minutes each time. Or I'll stick my entire leg in the cold swimming pool for the same amount of time. Now, for the stiffness, I will take a steam shower or a hot jacuzzi bath with Epsom salt, or I'll use what's called a bed buddy. It looks like a heating pad, but I stick it in the microwave and apply that to my knee. And the importance of that, I like using moist heat because dry heat doesn't have the same impact. The next step, go ahead.
I'm see before that. So moist heat is important, getting the moisture into your joint there.
Yes. Dry heat does absolutely nothing. It's the moisture that makes the difference. Like when I said I do a steam shower, when I'm in the steam, I oftentimes do a lot of stretches. And when I'm stretching and doing the steam, that just enhances, it gives me a deeper stretch and really loosens up my joints as well.
So stretching is actually okay. You're not going to injure yourself, even though it may hurt.
No. And the thing is, it's not about when you stretch, it's about taking your body to just a little bit of being uncomfortable or a little bit of discomfort, but not pain.
Got it. Okay. That's good. Great. And then, well, I'm sure people, if you take anything by mouth to deal with your pain, that should be something you discuss with your doctor. But what are possibilities that people should think about, or shouldn't they think about that?
Well, before I get to that, I want to mention one other step that I use. I use a TENS unit, also known as a transcutaneous electrical nerve stimulator. It's non-invasive and it's drug-free. Okay, so basically this TENS unit sends pulses via electrodes through the skin along the nerve fibers, and these pulses diminish the pain signal to the brain. So I really like that because, like I said, it's there's no drugs involved with that. Now, if that doesn't work, I go to my topical creams and ointments like Arnica, which is a homeopathic agent, BioFreeze, Salonpas, Voltaren. I found that it's best to rotate these creams because your body may stop responding if you use them over and over, back to back.
Very good. So let's, I want to repeat that information. What was that piece of equipment called that does the pulsating?
It's called a TENS unit, TENS unit. And it's also known as a transcutaneous electrical nerve stimulator.
Got it. Okay. A TENS unit. Okay. People write that down. That's important. And then these creams, what are the different possibilities, if you don't mind repeating?
Yes. Arnica is a homeopathic cream or ointment. There's BioFreeze, there's Salonpas, and there's Voltaren. Voltaren just was recently made over the counter. In Europe, it's been, over the counter for years, but it's basically a topical non-steroidal anti-inflammatory.
Got it. And everything you've mentioned so far, I'm impressed. I've asked twice now. I said, what medicines do you take? But you're not mentioning medicines yet. So you're really trying to stay away from that.
Right. So like I said, my goal is to start with the least invasive, non-drug method first. And then if things are not getting better, then I progress to medicines by mouth. Now, if the topical cream ointments fail, then I may increase my intake of turmeric and ginger, or it's an over-the-counter product called Instaflex. Now, Instaflex is a supplement that helps to manage osteoarthritis, and turmeric is one of its main ingredients. It also has resveratrol, black pepper extract, collagen, hyaluronic acid, and Boswellia serrata. Mm-hmm. And I have personally benefited from using Instaflex. And I believe the reason why it's helpful because of the unique combination of all the ingredients that come together to enhance, its effectiveness.
Right. Got it. Okay. And let's see. So if somebody's, let's say, really out of shape, they've been out of shape for a while, they've really fallen prey to the arthritis, and they're really, not able to move at all, and they're really out of shape. What kind of regimen do you recommend?
Absolutely. So, it's really important to maintain your physical activity. Very important. Some people are concerned, I know, that physical activity will make their arthritis work. That is not true. That's a myth.
Okay.
You
Good.
need to engage in joint-friendly physical activity because that can improve your pain and your quality of life. And it's a prescription for osteoarthritis. And you want to choose low impact activities that are easy on the joints and, have a low risk of injury. For me personally, I enjoy brisk walking, dancing, swimming, and I love to row because rowing puts my knee through a complete range of motion.
Right.
And I do the elliptical machine. Once again, that keeps your knees in alignment. And I do chair aerobics and biking.
Now, do you do this all at home? You have all this equipment at home, or do you go to the gym?
Okay, I used to go to the gym pre-COVID, but I walk in my neighborhood. I dance at home. I have a pool, so I swim. I do have a rowing machine, an elliptical machine that I've had for many years.
Yeah.
And also, it's important to strengthen the muscle around the joint. Okay, utilizing resistant bands are effective at building strength and decreasing your risk for injury. Because oftentimes the muscle around the joint that's has arthritis is weak. Mm-hmm. And it's important to build it up. And I think resistant bands are a wonderful way to build that strength. And I use Fit Simplify resistant bands. They can be found on Amazon. That's Fit Simplify.
Great. Good. So again, if I'm really out of shape and I've just been sitting in the chair watching TV and I don't want to move at all, what should I start with? Because I don't have a rowing machine. I don't have any home equipment. Where do I start?
Chair aerobics. Everybody have a chair.
Okay.
There's if you Google chair aerobics, they have, or on YouTube, there's tons of people who do chair aerobics, and it's phenomenal. And what you can do is, or if you don't want to do that, put on your favorite music, get in a chair, and you can do how should I put it? Tricep dips on the chair. You can sit there and march in place. You can do jump jacks. It's just like jumping jacks, but you're sitting in a chair, and incorporate, strength building exercise. You can get off the chair, do push-ups, or do wall push-ups if you can't do regular push-ups. So there's a lot of different ways that you can exercise in a chair. And then another piece of the equation that we alluded to earlier was stretching, which is absolutely necessary to help mitigate and prevent pain. And I use the stretch out strap every day. I just used it before coming on the show. It comes with illustrations and instructions on how to do each stretch properly, and every muscle group is addressed.
And it's called the stretch. I'm sorry, what's it called again?
Stretch out strap.
Stretch out strap. And that's a brand name people can look up.
Right.
Oh, cool. Okay, great. Good. So you mentioned before pre-existing conditions or risk factors that can cause arthritis. What should we know about that?
Yeah. So like I said, I had the two ACL injuries,
yes.
One in 80 and one in about 15 years later in the early 90s. Mm-hmm. And besides injury, anything that's overuse. So, and you can see overuse injuries in a lot of sports. So for baseball with throwing, you hear pitchers having to have Tommy John surgery on their elbow there, or you have, basketball players with knee issues, or tennis players with tennis elbow. So anything that puts the joint in a repetitive motion that keeps repeating the same movement, you're at risk.
And is there a way to minimize the risk again by stretching or warm-ups before you start having the arthritic injury?
Yes. And I honestly believe that a rejuvenation program needs to be instituted earlier than later, because most people get it and then they're trying to fix it on the back end, when we should be proactive, meaning that if you're involved in sport, or even if you're not involved with sport, you're just exercising, it's important to listen to your body. If you feel a little ache, go ahead and ice. If you feel a bit of stiffness, go ahead and do the heat methods that we talked about with the steam or the jacuzzi with Epsom salt. So try to do things and be proactive versus reactive on the other side.
Got it. And other than repetitive motion injury, are there other factors like I'm guessing diabetes, heart disease, whatever? Do they have anything to do with arthritis, or is there really no connection?
Really, it's merely a degenerative disorder with wear and tear over the years.
Got it.
But the thing is, if you address the arthritis with physical activity, with the stretching and strengthening, you're going to be just helping your health overall with those other chronic diseases.
Got it. Good. Now, we have a couple minutes left, so I want you to tell us about your book. KISS.
Yes, absolutely. My book is called KISS, Keep It Short and Simple for a Healthy, Sustainable Lifestyle. And basically, I give people tips about how to incorporate physical activity into your daily life and not leave it to the end of your day on your to-do list. You want to put short segments, interactive throughout the day. So weave it throughout your day, 10 minutes, 3 times a day, 15 minutes twice a day, because we know the American Council recommends 150 minutes physical activity per week. And that's the easiest way to do it. I talk about the 7-minute workout app, or doing the chair aerobics, or dancing and integrating body weight exercise. I also talk about nutrition, the importance of eating an anti-inflammatory diet like the Mediterranean diet. I talk about the turmeric, the ginger, the resveratrol, and really I'll talk about our beets. Beets are so great in so many ways. So I talk about different nutritional things and also mental strategies with mindful meditation and how to manifest the things you want in life and to keep focused on the task at hand.
And you're sure living this lifestyle, aren't you?
I'm doing my best to do that.
And it takes work, right? I mean, you're the expert, but it takes work and it's struggle and challenge, right?
Yes, it is. And the key thing to all of this is being consistently consistent, and to not overwhelm yourself with so much to do in a day, but being consistently consistent with little chunks or little nuggets or little habits every day.
Good. Yeah, and it's probably good to set alarms for yourself, right? So you get up. They're now calling. I understand. They're now calling sitting the new smoking.
That's absolutely true.
What does that mean? What does that mean?
Well, what they've been looking at is that when you sit for a long time, our bodies were made to move. Period. And they've even looked at people who exercise, right? Say you exercise for 50 minutes, but you sit all the rest of the day. That person is actually worse off than the person who may have exercised half that amount of time, but has been in a constant state of motion all day long.
Wow.
So it's important that we get up and move, because that's our bodies were designed to move.
Great. So I want to thank Trina Wiggins for being with us. You can reach her at trinawiggins.com. It's TRINA Wiggins, WIGGINS. trinawiggins.com, pediatrician. She's written this great book called KISS, Keep It Short and Simple, which is a great way to bring wellness and fitness into your life. Thanks so much for being with us today, Trina. It's been great to have you again. And if you want to watch Trina and her other presentation, you can do that in replay on either Voice America or by visiting gotohealthmedia.com. Trina, thanks so much.
Thank you for having me. It was
Good
a pleasure.
to see you.
Bye-bye.
Bye.
Thank you for tuning in this week to Go to Health Radio. Be sure to join Jonathan Marks and another health expert next Wednesday at 3 p.m. Eastern Time and 12 noon Pacific Time on the Voice America Variety Channel. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
Building a business may feel like a big jump, but OnDeck Small Business Loans can help keep you afloat. With lines of credit up to $100,000 and term loans up to $250,000, OnDeck lets you choose the loan that's right for your business. As a top-rated online small business lender, OnDeck's team of loan advisors can help you find the right business loan to fit your needs. Visit OnDeck.com for more information. Depending on certain loan attributes, your business loan may be issued by OnDeck or Celtic Bank. OnDeck does not lend in North Dakota. All loans and amounts subject to lender approval.